the Acting Chancellor, the Executive, Convocation, all dignitaries, graduates, friends, ladies, gentlemen, and colleagues. It's a singular honor and privilege for me to address this gathering in my own alma mater. I am humbled by the honor. I dedicate this degree, I'm from a rural area. So I dedicate this degree to people in deep rural areas and also informal settlements in South Africa. Graduates, congratulations. You have qualified at a time when South Africa is an exciting ground for all health professionals to showcase their skills, creativity, and innovations in strengthening the health system. Allow me to structure this talk in 5 sections. 1, the pain and joy of removal of apartheid. Some of you were not there then. 2, the rapid rise of the disease burden in South Africa. 3, unwise interventions after we've got our freedom. 4, the new light of good policy and political commitment. 5, the exciting role of health professionals as change agents. It may look more than many things, but it's for 10 minutes, all of it. The removal of apartheid was both tough and fulfilling. It was through a synergy from all sectors of society in the country. Important participants relevant for this talk included the African National Congress, of which I'm a long-standing member, United Democratic Front, and related formations like National Medical and Dental Association, of which I was a founder member. Black consciousness groups led by Steve Biko, and youth and women's groups. This university played a key role in the process in many ways. Yes, apartheid police would chase us around the buildings, very painful yet exciting as we realize the certainty of victory. When the heroes of the liberation struggle congregated in Durban with Madiba, one was thrilled to sing praises to them. Most of you wouldn't understand the original of the praises. But what it says was, today we rejoice, today we are jubilant. We salute you, heroes of the liberation struggle, for forfeiting everything to fight for us. You remain shining stars for all generations of humankind. That is what I said. But it's a meek and gentle version, what I've just told you, because my English vocabulary cannot go as far as Queen Victoria can. Namhla siyavuya, namhla siyachulumanga. Sizigopha amacala sinombulelo. Sithi mazene thole kunimatholo mthonyama. Ngokuncama yonke into nilwele thina. Niyakuhlala nimakhazikhazi ngokwengwenkwezi. Kuso sonke isizukulwane sikantu. Ubugorha benu basifaka uhlwabiyo, saqula laqina saliqingqitha, onke amajoni omkhonto aligangatha. Siqhathalaze sidudulwa sade saloyisa utshaba, kodwa kuyila makhalipha mhla sabagubungela. Andizukuyigqiba ke, ovayo makeve. Our constitution was then in place, and we felt the land of milk and honey was at hand. However, by the time apartheid was removed, it had already created very fertile conditions for the rise of the disease burden, especially TB and HIV, Mashaya Buke. The virus killed young people of childbearing age, and funerals are still the order of the day, leaving thousands of orphans. Kwasasemba, kwasasaqumelela. The third and very devastating problem came with implementation of our very good policies in the health sector. And this was unwise interventions in employing people not suitable for the job in leadership positions, especially as heads of government departments and sections. That is what is going to get the country to move very slowly over the next years. And if you are my age, you get worried about that. In the province of the Eastern Cape, there was a time when posts were not advertised, and comrades simply allocated positions to themselves without any advertisement. That province remains at the bottom of the pile in health and education to this day. The people that were employed in the above manner were very good, committed individuals who had fought very hard for our country, but were not good managers that would execute large health programs. By the time the problem was discovered, many vicious circles had already happened, including emigration of health professionals and collapse of sections of the health system. You go to Mthatha today, you will see what I'm talking about. Fortunately, government is currently addressing the issue and its consequences. And one is very grateful to our president for that intervention. Siyabonga msholozi. Nqanda nqamalala, ingqaka yaphalala. Now, coming to the new light that is shining for us to work better. We mentioned one, development of good policies, especially the National Health Insurance and National Development Plan. 2, political commitment of ministers of health, Dr. Nkosazana Dlamini Zuma, Dr. Aaron Motsoaledi. Those are shining stars in the health sector and leadership. And thirdly, training of more doctors in Cuba. My son was one of those doctors, but unfortunately there are too few and they come back and get swallowed by the system and things continue as usual. The 2 policies of NHI, National Health Insurance, and the National Development Plan, if implemented correctly, they will turn South Africa into one of the best countries in world health and development. The National Development Plan is, in particular, a shining beacon in the country. But it needs us to make it shine better. It cannot shine forever on its own. It needs community participation. It needs academics. It needs these people that were passing here to do another PhD. This is where you graduate health professionals can play a role. Last week, I was with the Minister of Health, and he was saying the health system in South Africa is designed for the rich and the poor. The poor are penalized by the financing of health care. Why? Because it is only people that are employed that are subsidized. Those out there who are employed, not employed anyway, they are not subsidized in the informal settlement, in the deep rural areas. We focus now on two ways in which health professionals can strengthen the health system, and these are, one, providing technical support in the form of clinical and specialist services to the Department of Health for implementation of the National Health Insurance and National Development Plan, which work together. Two, facilitating participation of local communities as full partners in government programs, in all government programs. Local communities cannot just be spectators when things are happening in government programs. Local communities need to be partners, full partners in all activities of government. And the government has already said that when they say together, we can do better. They have cleared the ground, so let's do that. So what one has done in this regard, we are registering a non-government organization called Foundation for Health and Development. And it will work in those two areas which we have highlighted above, namely technical support and also preparing communities to participate better as partners to all government programs. This will be something that the NHI will appreciate, the national development will appreciate. We've got all what it takes now. We've got it in the books, but the communities are not participating. And the government is actually reinforcing that by saying, next year we'll build for you so many houses. We'll do this and that. And then we will, spectators waiting for the houses. No. We can actually build houses. My father was a builder. We never got any tender. We did things ourselves. Maybe this is what should happen. This is what should happen. So in conclusion, an appeal is made now herewith to all health graduates. I presume all on the right-hand side are health graduates. To participate in the strengthening of the health system within the context of re-engineering of primary health care and implementation of the policy of the National Health Insurance, together with the National Development Plan, which has been accepted by all parties. I don't know anything which has been accepted by all parties in Parliament. There has always been some parties that are screaming, no, this and that. But when it comes to the National Development Plan, all, I don't know their names, they have agreed. So let's all, as health professionals, participate. Buy a donkey and goes.